Good morning. This is Lacey Nobles with the City of Lubbock. We will start our news conference in just a few seconds. Good morning, and thank you for joining us for the City of Lubbock COVID-19 news conference. Today we have updates from our panelists, Director of Public Health, Catherine Wells, Local Health Authority, Dr. Ron Cook, Lubbock Mayor Dan Pope, and today we welcome co-chair of the Lubbock Economic Recovery Task Force, Steve Massengale, is our guest panelist. So let's get going with Catherine Wells.
Good morning, everyone. Today I'm going to update you on our current numbers of COVID cases in Lubbock County and also review who needs to be isolated and quarantined based on the number of people that, or based on who's tested positive. The health department is reporting 3,231 cases of COVID-19 as of yesterday evening, July 8th. Of these, 1,491 are recovered and 1,682 are active cases. Unfortunately, we've also seen additional deaths here in Lubbock County with 58 individuals who have died due to complications of COVID since the beginning of this epidemic. For the fifth week in a row, there has been a week-over-week increase in the total number of cases reported. I know we've implemented a lot of new restrictions requiring masks, but it is going to take a couple of weeks for us to see those numbers start to reduce. And also for the month of July, the department has reported over 100 cases in 6 of the last 8 days. A few weeks ago, we anticipated that we would start seeing these higher case counts, and that has definitely become true. Controlling the spread of COVID-19 requires the entire community. I ask that everyone be smart when they're out, frequent businesses that are following the Lubbock Safe guidelines, practice social distancing, and wear that all-important face covering when you're at work, at the store, or with any group outside your family unit. I want to review a little bit about what to do if you're positive. If you test positive, we need you to stay home. Those who are positive need to isolate. This means no work, no school, no sports, and no visiting any stores for a minimum of 10 days after your symptom onset or that test date. In addition, you must stay in isolation until you've been symptom-free for at least 3 days. So the earliest anybody who tests positive for COVID can leave their house is 10 days. And we see many individuals who need to stay in isolation longer. It's also important that if you're a contact to a positive case, so that means that you worked in close proximity to someone that was positive, maybe your spouse or child's positive, you must stay in quarantine for 14 days from the last time you had contact with that case. Quarantine is similar to isolation. You can't go out to work, no school, no visiting home, not having any visitors to your house, visiting stores or restaurants. And some contacts will really need to stay at home even longer than the case. In order to control the spread of COVID, we need everybody in the community to follow these guidelines. These are the times where you're most infectious and you could spread this to others. So it's very important that you stay home, especially if you tested positive or if you're a contact to a positive. With that, I'm going to pass it over to Dr. Cook.
Thank you, Catherine, and I appreciate the opportunity to speak to everybody again today. You know, as Catherine stated, our numbers have significantly increased over the last several days. In fact, we had 180 positive cases reported yesterday. Our hospital numbers are up to 98 patients that are in the hospital related to COVID. And again, it's going to take 2 to 3 days, 2 to 3 weeks rather, for these numbers to fall after we continue to practice our social distancing and facial coverings and all the orders that are implemented by the governor and by the mayor. So it's going to take a little while to see these numbers to fall. And in that time, they may continue to increase, but we must do our part for social distancing and washing our hands and wearing our facial coverings and just keeping people out of our bubble so that we don't spread that virus and that we don't catch that virus. So I want to talk to you a little bit about our hospital numbers. You know, I've seen some websites that post that we have 800 beds and 184 ICU beds, but please know those are not just for COVID patients. Those are for everything else that we must take care of. You know, Lubbock is a regional medical acceptance center, and we take patients from all over the county and all over the state and eastern New Mexico as well. And so we must save spots and protect those spots that we normally have to take care of: traumas and burns and surgeries and strokes and heart attacks and all these other infections that need to be in the ICU. We can't afford to let those fill up with COVID patients. So those are just the normal things that we take care of. So just because we see a big number on a website that says we have lots of space, we could easily overwhelm those numbers if we're not careful. Just like Houston and Dallas, and now the Permian Basin. We have a number of patients from the Permian Basin here because their hospitals are full and they can't take care of them. And even though we have the staff that are capable of taking care of all of our hospitalized patients, some of those individuals are going to get sick too. So which decreases the number of people that can take care of the hospitalized patients. So we all must do our part to make sure that we stop and slow the spread of this virus. The other thing I want to visit with you about are all the social media posts about all these cures about COVID. I've seen lots of them, and they have to do with yogurt and vitamins, and they also have to do with inhaled steroids and common drugs that we use for other things. Please know that there is no cure. There is no drug that we can give that's going to stop this virus. And again, the only thing we have are these physical barriers, those three things that I talked about, to slow this virus. There's no cures. There's no panacea. There's no one drug that fixes everything. Absolutely none. And physicians, as a physician and other healthcare providers, we use evidence-based medicine to make decisions on how to treat our patients. And that evidence-based medicines are scientifically proven studies that are peer-reviewed, that are reproducible, so that the drug I give to make you better does what it's supposed to do, and I don't harm you by giving you that drug. And just doing drugs willy-nilly out of the blue because we think it works is not the way to practice medicine. Nobody should be doing that. And so there's no proven drug. There is one drug, remdesivir, which is an antiviral drug. It doesn't cure the disease. It doesn't decrease your mortality or likelihood of dying. What it does do is shorten your recovery time. Everything that we have to treat this drug, and we use, each individual is different. And so we use, depending on what the patient presents with, we use different techniques to try to make that patient better. There is no cure. We have to let the body heal itself. Physicians don't heal. We can only remove those impediments that keep the body from healing itself. We give anti-inflammatory drugs if there's overwhelming inflammation. If your blood pressure is too low, we give you medicine to raise your blood pressure. If you have an infection, we give you antibiotics, but we can't heal you. We can't cure you, but we do give those things in individual cases to make you better and let your body heal itself. That's why sometimes these very, very sick patients may be sick for months from this disease. And so we've got to be careful about what we give our patients. And so I just wanted to address that issue. One other thing that's not related to COVID, and that's our heat wave that's coming to Lubbock right now. So please, please be very careful in the sun. Try to get all your outside work done before noon, and then again later in the evening. I know that we have lots of people that cannot avoid those hours, but if you cannot avoid those hours and you're out in the sun, please take frequent breaks, drink plenty of water, and replace those electrolytes with Gatorade, and take care of yourself. If you start to feel faint, make sure you get in the shade and get cooled off. Continue to wet bandanas, the bandana you're wearing for a facial covering, right? Wet it, it helps cool you. Let the cool water run down your back and evaporate. That helps. So in these next few days, be careful and try not to get heat stroke or heat exhaustion. That's just another facet that I wanted to make sure we covered today. Masks save lives. Wash your hands, wear your mask, and social distance. Let me hand this off to Steve Massengill, our councilman. That's all that I have.
Thank you, Dr. Cook. Good morning, everybody. I want to give you an update on the Lubbock Safe program. As of this morning, we have 922 self-certified businesses that are part of this program. I think it's important to call everybody's attention to the fact that this program is still in place and very important in our community. If there's a business that you frequent and you see that they are not certified Lubbock Safe, you might ask them or encourage them to go to the city website. They can go to mylubbock.us/Lubbock Safe and go through the process to get self-certified. It's very important. I hear from citizens all the time that still appreciate the fact that the decal is on the door, showing them that that business has gone above and beyond to keep not only their customers safe, but their staff safe. So if you know of anybody, we would still invite all businesses that are not a part of that program to participate. Next, I'd like to give you an update on our recovery task force. They've met most recently this past Wednesday. That was our committee that's called the Get Lubbock Open Committee. And they worked on and interpreted the governor's most recent order as it applies to our Lubbock Safe guidelines. And those guidelines should be updated on our website by tomorrow. As it applies to facial coverings. We also worked on the portion of the governor's order that is moved, that requires the approval of the mayor for outdoor gatherings of 10 or more. And as you can imagine, that we have gotten quite a bit of input from many groups that are seeking to be approved. The Recovery Task Force group that met on Wednesday discussed this, and they've implemented a program where if your gathering is from 10 people to 49 people, that we're going to have a form that we hope will expedite the approval. So if you'll again go to mylubbock.us/Lubbock Safe, tomorrow that form should be live. It should be a PDF that you can fill, a fillable PDF, and you can submit that form to Lubbock Safe at mylubbock.us. That's the email. We ask you to submit that form at least 10 days before your event. And we're working very hard to respond to you within 24 hours. Our goal is to get everybody's event approved so that you can have your outdoor events. So if you know of anybody having an event and they're not aware of the approval process, please make them aware and know that we will work hard to with you to make sure your plan is safe for all your participants, and we'll get back to you as soon as possible. That's a Recovery Task Force update. And with that, I'm going to hand it off to Mayor Dan Pope.
Thank you, Steve. Good morning, everyone. I want to start with some data slides today. So allow me to share my screen, please. Okay, let's 4 slides today. This will be the last 2 weeks. The final slide goes back a month, but cumulative case count, total case count over the last 14 days. Excuse me, I think I've got one. That's you can see that we're averaging about a growth of about 112 per day over the last 14 days. You can't see that. I just told you that. Okay, so here's the this is a 14-day rolling average of our positivity rate. And what this shows is in blue are the daily negative tests, and in orange are the daily new cases, the positive test. Here's the takeaway. Our daily rolling average for positive test is nearly 15%. Remember that we've talked about this since March. We've wanted to keep it under 6%. We were around 3.5% a month ago. Our cumulative back to test one is now about 6.9%. So our efforts are to try to get this positivity rate down. Third slide is case count by age. So 1,562 new cases in the last 14 days. 37% of those are in the 18 to 29 age group. But you will notice since we last showed this slide that you see a larger percentage of new cases in the 30 to 59 age group, sort of showing that what was a spike in our 18 to 29-year-olds has spread into, naturally, I guess, spread into other parts of our community. Finally, sort of our hospitalized patient slide. So a little different than what you're looking at used to seeing. This goes back 30 days. On June the 9th, we had 14 patients in the hospital, 99. You can see that 43 of those are in ICU, and the balance of those are on the floors, and it doesn't. I'm just looking at that the math works. 90. I said 99. I guess it's 98. We had a good conversation yesterday morning with our hospital CEOs. They still remain confident. Their hospitals are very active with regular business, with what we like to call elective surgery, which a lot of elective surgery is needed surgery. It's not something you could do without. So their business has picked back up, and they see more COVID patients. Both UMC and Covenant have plans to continue to be able to handle these volumes. But it is important that we start to bend this curve back the other way. Just a moment about the governor's mask order and how that impacts us. So you'll recall that last week the governor mandated face coverings in the state of Texas, with a few very few exceptions. Now, I talked to Governor Abbott yesterday morning. He called to thank I think he said called the very independent people of West Texas and Lubbock for taking this seriously. And he acknowledged that this is different, but we agreed that it's the right step to take right now. You know, there was a time in March when the CDC told us that face coverings did not help in slowing the spread. However, that has changed. In fact, just this week, just Monday, the CDC added even tighter specific guidance about the importance around face coverings. So remember what we talked about at our very first press conference. It was at the Fire Admin Center. And I said, we will make the best decisions possible using common sense and all the information we have at that time. That has not changed. And we will continue to try to make decisions like that. Okay, so let's talk about our experience with the mask order, face covering order in Lubbock. Our charge to our folks is this: we want to educate and encourage our businesses and citizens to wear their face coverings. Only after doing those two would we enforce. We have not written any tickets. In fact, we've not even had to write a formal warning. People have been responsive. Earlier this week, the city and the Chamber of Commerce distributed 120,000 masks to businesses, free. So those businesses can protect their employees and their customers. You should be looking for those for that when you enter a business. Are they taking care of you? Are they taking care of their employees? Most of our activity since last week around enforcement, or when we get phone calls to the Lubbock PD non-emergency number. And by the way, we've had every day we've had more than 5, but less than 10 of those calls. Most of those calls have been around, either restaurants that people didn't feel like were following the guidelines, or we've seen some of our activity move from, to pool areas and some of that. But once again, I feel like our people have been very responsive, and I'm thankful for that. Okay, one more bit of good news and then a wrap. Walgreens, you may remember that maybe 60 days ago, I indicated on one of these calls that we had asked Walgreens for some testing help. They're doing that in larger cities in Texas, and we've continued to talk to them, and we're glad to announce that tomorrow, beginning tomorrow and for going on for the foreseeable future, they will be running a free drive-through testing clinic on 6th Street and Avenue Q. Now you'll need to go onto their website and register, take a little a short quiz or test. We will be pushing that information out today in English and in Spanish. Walgreens is a very good partner, and we're very pleased that they've answered the call and are helping to provide testing to our citizens. I would just wrap by saying that I know this has had an impact on all of us, and our lives are different, and we observe 4th of July differently. Many of us have found ourselves in situations where we've quarantined to safely and sensibly return to a life that we wake there. I don't think we're on a short road. I think it's a relatively long road. Our efforts to slow the spread, to use our good common sense, to take care of our neighbor, to take care of our family member, they're critical. So please do the right thing. Be a West Texan, be a Lubbockite, wear your mask, take care of your neighbor. Lacey, back to you. Thank you.
Thank you, Mayor, and thank you to all of our panelists. We will now open it up for media questions. Today's order is KMAC, El Editor, The Avalanche Journal, Fox 34, KLBK, Latino Lubbock, KCBD, and Texas Tech Public Media. So we'll start with KMAC and Matthew Stell.
Thanks, Lacey. My first question is for Dr. Cook. Dr. Cook, you spoke about our hospital system and hospitalizations. Give us, what is the overwhelming point for our hospitals? You talked about overwhelming our system and comparing Houston, Dallas, Austin. What is Lubbock's overwhelming point?
Well, I don't quite guess I understand your question there, Matt. My overwhelming concern? Is that what you're asking me?
Now, earlier you mentioned that we don't, like you said, we don't want our hospitals to get overwhelmed with patients in general. And so I was asking, is there a specific number of people that we can have in the hospital, whether it be ICU or what? What is that number? What is that point to where we have overwhelmed the system?
That's a great question, Matt. That number is a little bit nebulous. We still have, and it's a conversation that we need to have with the hospitals, and it's a very dynamic and moving. It depends on the number of traumas. It depends on the number of burns. It depends on the number of patients that are being transported here, because we're a regional acceptance center. You know, we're the biggest city between Albuquerque and Dallas. And so we get a lot of stuff. We get a lot of oil field trauma. We have our own trauma, obviously. And so it's all those numbers playing together that then say how many COVID patients that we can handle. And as we see our hospital numbers go up, and as our ICU beds are occupied, whether they're COVID or whether or not they're trauma or surgery or stroke or heart or whatever, it's just a dynamic number. I can't put a finger on it, but I know that as those beds narrow, then that should make us all nervous.
And you kind of touched on just a little bit on my next question is we're seeing, I'm assuming we're seeing a lot of folks being treated for COVID-19 that are not from Lubbock County. Is that the case? Maybe from Hale County or from Hockley County, or are those folks being treated in their respective counties, or because Lubbock is such, like you said, a premier place for medicine, are they coming here?
Well, that's up to the hospitals. Yes. To answer your question, yes, they're coming here. We have some from the Permian Basin, because the hospitals in the Permian Basin are at a point where they can't handle any more acutely ill COVID patients and so we always have trauma patients. We always have burn patients. We always have stroke patients. But yes, we always have patients from out of the community, but we're having some come in from the Permian Basin. We always have them come in from our regional hospitals that can't handle a very acutely ill patient. They just don't have the staff. They don't have the expertise. We have the expertise here in Lubbock. We have the specialist. We have the cardiologist. We have the pulmonologist and critical care specialist and the nephrologist and all these people that are required to take care of these kinds of patients when they're that sick.
Got it. Thanks so much.
You bet. Thanks, Matt.
Okay, now we have Olga Aguero with El Editor.
Hello, everybody. Hope everybody had a good, blessed July 4th. This is for Catherine. I heard you talk about, people being told once you're being diagnosed as positive, but the word tracer was never mentioned on there. I want to reconfirm if the tracers are still intact and the responsibility of the tracers. I mean, once a person is being told that they're positive, is it up to the tracer to get a hold of the people that were in contact with that individual, or is the responsibility being given to that individual to get a hold of the persons that were around them?
Yeah, Olga, our tracers are very much out there and calling individuals. But with every time that there's increased case numbers, that turnaround time with the contact tracer is a little bit longer. Our goal is still within 24 hours. But when someone is diagnosed, especially now that we have all of these rapid tests, they need to make sure that they stay home until that contact tracer is able to call them and chat with them. So we really need people to do their part as we're getting more and more cases out there in the community.
Okay, thank you. The second question, Dr. Fonsi says hard-hit states should go back and do it right. Mayor, if the numbers don't go down or there's no changes within, you mentioned 2 weeks, and the percentage doesn't go to the 6% that we would want it to go, what is your plan as mayor for us?
Well, thanks for the question, Olga. I don't really don't want to answer a question based on something in the future. I think it's most important right now that the governor's mask order, that we socially distance, that we do the things that we know slow the spread of COVID-19. I do not support returning to a stay-at-home, shelter-in-place, whatever you want to call it, order. That impacts too many families and too many workers who have to put food on the table for their families to get by, and that's where my heart and my head is right now.
Thank you.
Okay, thank you, Olga. We'll now move to Matt Dotre with the Lubbock Avalanche Journal.
Hey everyone, Ms. Wells, I wanted to ask you about quarantining. So you talked a lot about individuals quarantining and self-quarantining. Are you seeing people kind of deliberately, I guess, disobey quarantine orders?
I think it's more of a misunderstanding. People really need to take to heart that when they test positive, they are infectious and they can spread that to others. And at that point, it is very important that people follow those guidelines that are provided by their physician when they leave the office, and then when they're contacted by the health department.
Mm-hmm. And I guess a couple weeks ago, when we were seeing the rise in cases in young adults, we were talking a lot about the fears that they spread it to their parents or their grandparents. And I guess looking at the age range that the mayor was showing, is it fair to assume that kind of did happen? Are you seeing instances where young adults were giving it to their parents over the weekends and things like that?
Yes, we have. What happened was we ended up with an outbreak in a large population of the community that created a lot of additional virus or viral load in our community, which then increased the likelihood of others becoming infected. So it is true. We see most transmission occurs either in the workplace or in the household. So when you return home, you're likely to infect those people that are also in your household.
Okay. Thank you.
Okay, now we have Brady King with Fox 34.
Good morning, everyone. My first question is for Ms. Wells. How many people of the cases in total are people who don't have any symptoms? And is there still a concern that asymptomatic people can spread the disease?
There's a little bit of concern about asymptomatic, but the one thing that we're seeing the most with our case investigations, especially when we go in and screen people because of possible exposure, is they tell us initially they don't have any symptoms, but a day or two later, they're able to report some very significant symptoms. And I think that goes back to a lot of the studies now showing that people are most infectious right before their symptom onset. So I don't think there's as many people true asymptomatic. I think they get tested because of an exposure and then they become symptomatic the next day or two.
So Brady,
Okay, gotcha.
Brady, is Dr. Cook. Let me also
Thank you.
reiterate that yes, there are asymptomatic carriers, and that's the unique thing about this virus, that most viruses we have, pardon me, that when you become ill, that's when you're shedding the most virus. But in this particular virus, this new novel virus, that something we really haven't seen before is the ability to shed the virus and infect others before you truly become symptomatic.
Okay, thank you both. And then one more question for Mayor Pope. According to your slide, did that show that the percentage of 20-somethings, 20 to 29, that were spreading the virus, I guess, was going down? And do you think that Governor Abbott's order to shut down the bars helped with that?
Well, I think certainly we've seen it's going down as much as we're seeing more spread into other age groups in our community. A little early to judge whether the bar closure has had an impact. It'll be, I think, 2 weeks at lunch tomorrow. And so let's you heard Dr. Cook say 2 to 3 weeks earlier. We don't want to call it a victory on that yet, but maybe the trend's going in the right direction.
All right, thank you so much.
Thank you, Brady. Now we have Terry Furman with KLBK.
Good afternoon, everybody. My question is this. We've got a lot of people calling from businesses saying that the business knows that someone is tested positive and they're not doing anything to protect everyone around them. What does the governor's order, what do you recommend that these people can do if they're not being taken care of in their workplace?
I'll start and then I'll let the medical people talk about this. We take this very seriously. If we need to know about it. We want to talk to the business owner. I've had a few limited situations with infected citizens going back into the workplace. We've had a couple of reports of businesses that were requiring people to work that they were sick. We've not been able to confirm those, but we have taken action on every one of those situations. Now, let me put a caveat on that. What we don't want is a bunch of people who don't want to go to work calling in to implicate a business that is innocent. And we've had that happen also. This is not nursery school kind of stuff. It's very serious. And we take it that way. And I'll yield to Dr. Cook. He's the public health authority, and he's a number of times had to put some orders in place if needed to make sure we do things the right way. Ron?
Thank you. I agree with Mayor Pope. We don't want people returning to work after they've tested positive by pressure of the employer. That doesn't do any good. That just continues to spread the virus, and it may infect the whole employment the place of employment, and then they'll have to be shut down, or because if necessary, we have had to put orders on institutions and individuals not to do that, not to go to work, or to stay in place rather. And so we just can't afford to let that happen. That just spreads the virus. And I know it's a burden on the employer, but it's also going to be a bigger burden if more people at their institution are sick. And so please play by the rules. They're there for a reason. And so we just don't want people returning to work until your 10 days or 14 days, depending on the scenario, 10 days minimum are up.
Okay, well, let me follow up to that. What do we tell these people then when they're emailing us? Do they need to call someone in particular saying that, hey, someone at our business has tested positive, and they're telling us to just keep it quiet? What do we tell them?
We want them to call the health department. Same thing we've said since day one. With the phone number.
Yeah, the phone number is 806-775-2933, or they can also email publichealth@mylubbock.us.
Wonderful. Thank you.
Thanks, Terry.
Okay, now we move on to Christy Martinez Garcia with Latino Lubbock.
Good afternoon, everybody. I'm Christy with Latino Lubbock Magazine. And data on coronavirus death rates remains imprecise, due in part to limited testing availability and the prevalence of mild or asymptomatic cases that often go unrecorded. But thank you for adding Walgreens. Many experts have warned that we shouldn't take comfort in the dropping death rate among coronavirus patients, claiming it to be a false narrative to take comfort in a lower rate of death. And with deaths mildly rising locally and even in our rural communities who are interdependent with Lubbock, why is there not more acknowledgement and emphasis placed on the deaths in the daily updates when they occur?
Catherine, you want to talk about that?
Yeah, I mean, we're concerned about every death that is reported to us. We also want to allow those families to mourn those individuals, and we're not going to provide detailed information on exactly who died. We definitely want to keep the confidentiality, of those individuals. We are reporting age, ethnicity, and we also have provided some information if it's either a nursing home or not a nursing home.
And just
I'd like to just add, I'd like just to add to that, Christy, and just say that thank you for asking the question. In no way do we not completely take every death very seriously, and if we've come off any way other than that, then I apologize. That's what this is all about. It's about trying to provide a safe environment for our citizens.
thank you.
If I could just add, I agree with the mayor, and we find no comfort in reporting any of these deaths. And I think that's why we emphasize those numbers of our hospitalized, because we're very concerned about making sure that we don't add to the death rate. And that's why when we talk about, and when Dr. Cook talks about our hospital capacity, that's why it's so important.
Awesome. And, and I think what we're hearing from the public is, and I don't think they want to know who it is. They want to know how it happened. They want more details about that because of fear for their own lives. But let me go on to my next question. And first of all, thank you all for doing what you're doing. But Mayor, and you look rested, by the way.
Thanks.
We appreciate that you're putting effort to meet with citizens in town halls, and that I know being a public figure is a tough role, but as a leader, some citizens are concerned that you're not setting the best example when many local organizations have had to cancel their events or convert them to virtual events for the safety of the public out of concern that some aren't going to observe social distancing or wear masks. And as you've stated multiple times, this can't be enforced. And even by the lack of enforcements, which I'm seeing a lot of people with no masks. But that being said, why do you continue to hold these town hall meetings? And I know you're having your ice cream event next week. Have you considered holding Zoom town halls to prevent from having to potentially expose or create opportunities for individuals to contract the virus, more so that you can set an example for the general public?
Yeah, it's a really good question, and so let me answer that a couple ways. I think it depends on the event. So next Monday night, as an example, the 100 Black Men of West Texas are holding an online forum. Originally, we wanted to do it in person. We're helping our community engagement task force is helping partner with them for that. Originally, we planned on doing it in person and then maybe a hybrid in person and online. And we've decided to move it. They've decided to move it all online. I applaud that. It should be a large event. We are doing ice cream with the mayor next week. You mentioned that. We normally do lemonade with the mayor in the summer at one of our libraries. This summer, we decided to do an ice cream with the mayor in District 3. We will control, since it's in a restaurant, we will be under the governor's guideline on occupancy. We also will require face mask, and we will make sure we have social distancing in place. So I think we're able to set a good example there. Your question is a good one. If we find that we can't do it the right way going forward, then we'll move them to online, Christy. I promise you that. Thanks for the question.
Thank you, Christy. Next, we have Karen McKay with KCBD.
Good morning. I am asking this on behalf of an area doctor who says that a lot of our cases are inflated based on a new CDC additional definition called a probable case definition, where, in other words, one confirmed case could be a dozen cases based on exposure. So what are we doing here? Are we following that model, or are all of our positive cases positive because of a test or simply because of exposure?
I'll go ahead and take that one, Karen. Everything that we're reporting right now at the City of Lubbock Health Department is a lab confirmed case. So that means the person actually had the nasal swab, and that got reported back to us. We have not included any of our presumptive positives. We're also not reporting anybody that has an antibody test.
All right, thank you, Catherine. And also I have a question for the mayor. Mayor Pope, you've been quoted as saying this is personal to you now because COVID is in your family, and I'm sorry for that, but would you be willing to share more about that and how that has changed your lifestyle? Have you been in quarantine?
Yeah, it's a good question. Thanks for asking. Two of my family members, one of my brothers that does not live in Lubbock that I've not seen since COVID-19 began, have fought a 10 or 12 day COVID-19 experience with high fever, and I'm pleased to report that he's doing much better and is on the road to recovery. My daughter, who lives in Lubbock, tested positive. She did her health department ordered quarantine and is now through that period and has gone back to work. My wife was exposed to her during that period of time when the health department said she could have already been positive. So my wife quarantined. I took an abundance of caution. I wouldn't say I specifically quarantined, but I've stayed away from virtually everyone. I did have a test. I was tested last week and tested a negative. But as you know, sometimes it can take a while to manifest. So I've tried to be very cautious. In fact, I'm out of town for a few days this week on what has become a working vacation. I would say that about the asymptomatic carriers, we got to watch that through our daughter. We joked that her only symptom was boredom. She had no impact. And so we're thankful for that. But to me, it really hits home how someone as vibrant as a young person can be positive and potentially could have impacted a lot of other lives.
Right. Thank you, Mayor.
You're welcome.
And lastly, we have John Seaborn with Texas Tech Public Media.
Good afternoon, everyone, and thank you. I have a couple questions. I believe they'll all be for Catherine Wells today. There's roughly around 1,200 investigations that are still pending, according to the dashboard, going back as far as June 16th. And so, what is the average turnaround that we should expect on those? And then at what point does some of that information become less valuable as far as the exposure site from stuff that is further than 2 weeks in the past?
Our goal at the health department is still to complete that initial investigation within 24 to 48 hours of that case being reported to us. There is a lag time between that investigation being done and when the official investigation gets closed out and updated on the dashboard. We're working to increase the number of admin staff here so that we can start getting that data back into the dashboard. But we take action on whatever happens during that initial case investigation, regardless of whether or not it's closed or not. So the data is fresh that we're responding to.
Okay. And then I believe in June we were looking, or the city was looking to hire something around like 40-ish contact tracers. Have those positions been filled? How many contact tracers are currently employed? And is there a need for more as the cases are rising?
The 40 contact tracers are actually the Department of State Health Services. So that's our state health department recruiting for contact investigators and contact tracers. The health department's currently using lots of individuals from other city departments that are helping us. And then in addition, we are working on hiring some temporary or long-term temporary staff to be on board for the fall, because we anticipate case counts to continue when we hit the flu season in winter.
Thank you.
Okay, this concludes our news conference today. I'm glad to be back with all of you after a couple of weeks. Remember, for information for businesses or for gatherings, you can go to mylubbock.us/LubbockSafe. And in the meantime, have a good week.